cut motions and oppose the demands. Speaking because on the health ministry, Goa Medical College, Goa Dentistry College, Institute of Psychiatry and Human Behavior and Foods and Drugs. Because of Poile Swater, healthache oloitna. Because I truly believe that the overall performance of the health ministry are two big contrasts and one sea of indifference. This is my feeling. It's because the focus of the ministry, Soglo focus ministry is only on GMC. It's because the health service ji amge hi suvidha जावं urban area, rural areas, most of this is inadequate. I believe when senior Pratap Singh Rani was the chief minister, ye je structure ani खास करून काँग्रेसाच्या टायमार हे जे बांधलेले. Today most of this is in dilapidated condition. It's because one very important aspect is that I feel the focus also should move towards the mental health. Zaite karna lagu. Pakadista, if you look at the rising cases in IPHB, this is something also, apart from the physical health and the physical disease, the mental health padha because of the stress. This is something that is very, very important that the health ministry needs to look into. It's because if I sum this up, I feel that through better attention, rather than run-of-the-mill approach, it should not be run-of-the-mill approach, it should be a better attention and better focus on all these three problems. It's because Goa Medical College is always shining in the media. म्हणजे मंत्री सदांच Goa Medical College'acher press conference dita, media, his intervals on speciality, super speciality, continuously he's on the media. Because J announcements of cancer treatment, in vitro fertilization, breast cancer, several other treatments. Because this creates an atmosphere that all is well. The Munna by MBBS picture to Sanjay Dutt, all is well, all is well. It's because this catches the eye of the people. And at that times, because it looks very outstanding in the media, but the reality of GMC is because of the hospital is very, very different on the ground. Ada soglyank khabar ha ki practically the doctors are trying their best. But GMC in Pulswater beds, the number of beds is inadequate. Kitle amgele patient are kept on the stretchers, day in, day out. Kitle phone yeta. No wonder the health minister's office is very alert and they support us from the experience in the last 2-3 years. And that's because, or if you look, why are these beds inadequate? Kidak, Dakshin Goanche, South Goa District Hospital, Ponda Hospital, Zao Mapsache Azilo Hospital, Sogle Hospital have become referral hospitals. Referral hospitals, which because is something that is the failure of the system. Soglo load GMC cheta. If we provide better equipment, doctors, surgeons, Magadistas because Goa Medical College or load deontolo. And that's because आम्ही सदांच मंत्रीच्या मुखार हें हाडलें या सरकारा मुखार तें हें हाडलें मुख्यमंत्रीच्या मुखार हें हाडलें बट म्हाका दिसता हूंय ना हूंय देयर इज अ फेलियर there is absolutely a failure that the structure of our UHCs, PHCs, South Goa District Hospital, North Goa District Hospital, there is no coordination. It's because the recruitment and routine of lower category staff at GMC, this is always because of a hot topic within the media as well. And the bell curve tilts towards Sattari. It's because J budget provision yes, Herkaran of 107,135 lakhs is made for 24-25, which is only 1.94% more than your revised estimate. And there are some findings. There was a question in the morning about the equipments. Few audits that I would like to place to the Honorable Minister. There was an instance where high-value equipments were procured and they were kept idle. That delay had a loss of about 5 crore 95 lakhs. Has government done anything with regards to that? Mukhyamantri Sodan Munta ki patient increase zale. When patient increase, I believe proportionately the consultants also need to increase. Examples, because if you look at the neurology department, it is always overcrowded. You imagine people coming from Kankon, Sangye, Penne, they come there, because most of the time appointment na manon dusre disa tenka ti cheat meta. Then they call us as politicians, we have to request the doctors जाऊं, dean, आमगे बांडेकर बाब जाऊं, Patil बाब जाऊं, सगले दोतोर ते help कोते. But sometimes they cannot do anything. So this failure of how do we address, so this is something that I believe is because of the failure at the lower level district hospitals and the PHCs and the UHCs. It's because this government basically has failed to provide this number of beds to the patients. And now, Ogdache Janna Oloitna Speaker Sir, sometimes I believe that these medicines are not available, some implants are not available, and this is something, because of that, the patients normally are sent for, they have to wait 1 mahina raupa pota, 2 mahina raupa pota. Khas karun dialysis, the amount of unit and the setup that is required. Normally, if a patient is diagnosed with dialysis, he has to undergo dialysis with the high creatine level, SGBT, SGOT level. And that patient has to be taken practically sometimes every day. But it is very, very difficult with the current state, especially in rural areas. Kankonच्या गावांत Speaker Sir, हो प्रश्न हा. Anik म्हाका दिसता जेन्ना we spoke about that last time, we had asked whether a study was done on why these kidney ailments are happening, especially in the belt of Kankon. What is the way out? See, just dialysis is the curative part maybe for temporary, but actually what is the main reasons? Because अनेक प्रश्न जो GMC ने येता तो म्हटल्यार जे emergency type of a situation, and when patients are referred to hospitals in private hospitals. आनीक पेशंटाक जेन्ना रिजनेबिलिटी म्हणून हे लोक थिंगा मागीर GMCन सांगता हें बिल पोत्तें येवपाक. I believe that there is no coordination. This reasonability, whatever, I don't think any patient or any relative will know whether it is reasonable or not to go in the hospital. It's because medical waste or waste, there are several cases, and this is sometimes not disposed properly, and this is the need of the hour to avoid any vector-borne diseases. Ada तुकाय जायत पुसा येला आसतलो फोन की पेशंटाक जेन्ना ओटी नव्हता आनी तो मागीर भिलो आसता की हाल आपूण ऑपरेशन वयत बी म्हणून. And sometimes they kept NBM or nil by mouth. Now, when you take them in the morning in the operation theatre are bhaयर and because of je OT thinga suvidha or operation theatre is busy, because of that they are kept pending for 2 days, 3 days, 4 days, several times. This has happened. These are common practices because that move around Goa Medical College. Now, Speaker Sir, I believe that the annual purchase of medicine, Orsa Oros, annual purchase, it is sometimes delayed, and due to lack of the finance. Due to lack of finance, this is delayed, and then you all end up purchasing medicine at market rate, which is voluminous at expenses today. Why I'm trying to raise this is because there is something that the audit has pointed out about the non-finalization of the annual tender in the past or whatever, whether it is still happening. Because many times they say that you all freeze on the amount of years for 1 year, 2 years, you all bargain with them. I know about that. But Speaker Sir, I believe that this medicine should be procured, implants should be, you all need to procure this. Ada, जेन्ना आमी प्रश्न गायले स्पीकर माय रिप्लाय 52 इट सेज जे GMCचे जे स्टाफ क्वार्टर आहे हे स्टाफ क्वार्टरान स्पीकर 38 नंबर ऑफ बिल्डिंग्स एज पर PWD आउट ऑफ 38 27 numbers of these buildings are declared to be unsafe. म्हणजे हिंगा they are still occupied by staff, maybe even medical staff. PHC Kurtorim, PHC quarters, administrative building Kurtorim, forensic lab je Verna, PHC je Lotle aha, all are in bad, dilapidated condition. Speaker sir, Poir health center ek Kurchorecha Goan, you have inaugurated it, but because I still feel there is a lot of equipment that is needed there. There were issues with ambulances. I think you've given them a cardiac ambulance recently, but there was a lot of need for ambulances. Private ambulances were taken free of cost. But Speaker sir, ambulance is another thing that I would come in details. Because sir, अनेक बारीकसो जो problem हिंगा जाता is that आमकां एक representation दिला with regards to the stipend of the medical graduates and the foreign medical graduates. Even after the Supreme Court guidelines, एंका जे 30,000 मेळपा जाय ते अजून implement हे सरकारान केलना. With regards to giving justice to the reserve category of ST, SC during post-graduate medical seats, and this also, Speaker sir, is pending for a long time. Now, Speaker sir, Goa Medical College is the main building. This the college building. This, Speaker sir, as per reports, can collapse anytime. Speaker sir, lecture hall je where lecture is being taken, this lecture hall has been abandoned. Speaker sir, structural certificate ji Goa Engineering College and Delhi, the validity of this structural certificate is about to expire. 2 Norsa Delhi. This is about to expire. 108 offices building ha, आणि जे central stores ha, that is about to break. Speaker sir, pharmacy je tinga ha, it is leaking in the center. GSIDC has left it open purposely, I don't know. Tinga je medicine dodai, tinga udkant, bizon. Whether, Speaker sir, this situation, it is not only dangerous to the doctors, dangerous to the patients as well.
Yes sir, तो purposely म्हणता पळय न्ही, म्हणजे GSIDC कितें उदीक गळोनी म्हणून दवरतले.
अरे माय मोदे कितें थिंग पोत्रे हे जाला, पोदे होला हा थिंगा तूं वचोन चोय. तूं गेला थिंगा.
Purposely कोण दवरतलो फार्मासी
तरी दवरतलो. चेक कर थिंगा कांय हे ना. This is you ask, confirm it. This is the current situation. Speaker sir, one critical issue which is very, very important and something that the health minister needs to look at is the neuro disability in children. These are special children especially with autism. Autism, you've spoken about it. Now, if you look at the spectrum, it is quite wide. And early detection of this is the key. Early detection of autism spectrum and the mental disorder. And that's because of examinations and korpak jai, this is lacking. Kityak lack zada, Speaker sir? Kityak there is shortage at IPHB, shortage at South Goa District Hospital, shortage at North Goa District Hospital. Speaker sir, je clinical psychologist ha. Speaker sir, clinical psychologist ha. Mukhyamantri Mashe Rao tu. Mukhyamantri Bab, ya Mashe aik mare. Speaker sir, clinical psychologist je thing hai. Even after you all advertising the post, even after giving relaxation, still there is a shortage. Speaker sir, je दोन district early intervention je tungele center hai in North Goa and South Goa to get an appointment to na kone na relax pasun kel tumi kitle trend card you all have how many times you all have relax. See you all need to. Speaker sir, ye post je Mukhyamantri boda advertise kela kone na. You all have even given relaxation for that. Nobody is coming, but the children are suffering.
Post advertise केल्या कालूच फाईल परत पळयल्या हांवें ती. Actually काय सांगता रे 8 काय 10 जण कोण तरी आयला तिची कमिटी उरलेली पळय न्ही ती कमिटी आता फक्त इंटरव्यू घेतले आणि ते सिलेक्ट करतले. म्हणजे पयर हांवें ते हे जाल्या उपरांत रिवाइव केला.
Speaker sir, जे shortage of staff ha म्हणून there is a delay of even 4 to 5 months for an appointment. आतां जेन्ना सगळ्या भुरगें जाता, when there is a child in the family, every parent feels that no, nothing is wrong to my child. It's very difficult to detect. Sometimes you see aggression in the child. It's a very different pattern. They feel no, everything, all is well within the child. But by early detections, because when the child is in a mess, or when parents are facing these problems, this is a very, very serious issue. Burgyak, early detection, it helps them for their future growth. Iskolant, I think we need to have resourceful rooms in schools also, and resourceful teachers who can detect and identify that yes, there is something that is going wrong. I believe this is part of the system that we need to follow. It's because Sokani Ami Uleile with regards to the functioning of the casualty. Now, the waiting period on an average, tumkai hobar ha. I'm not blaming the doctors, but 3 to 4 hours, 3 hours, I think casualty astat. Only GMC, 3 to 4 hours. Technically, if you have the periphery equipments lined up at the side, you need more consultants. Ada serious patients, intervention and quick diagnosis. हे 1.5 वरां भितर जावपाक जाय आनी हें थिंगा जायना. वाय कित्याक जायना? बिकॉज 150 ते 160 इज एन एवरेज. हांवें एवरेज काडल्या किच 150 a day patients come in the casualty, and every 24 hours 150 serious patients. Now it's because जे CMO officer आहाय ते 15 वर्सां जाले, 17 वर्सां, they join and they retire in the same department, same setup. आता 17 वर्सां जर तूं हांक बरो दिसता हिंग येवपा 17 वर्सां, because but you imagine the doctor's condition in the same setup. They cannot be professors. I believe he's relaxed some norms to make them associate professors, but somehow you need to increase this number of because of the consultants. Because same issue casualtyचो South Goa districtan तरी हेजा पाड आहा सारके. It is worse. Because the health minister, I believe, you should look at approaches like an alternative emergency department on the lines of All India Institute of Medical Science. That is something due to they have trauma care and something like that, which you have them working day in, day out at that time. It's a very successful module in Delhi, and I believe that if you try to introduce something like that, we can maybe possibly save a lot of lives. We spoke about stroke and STEMI patients, and I believe that this spoke and hub module was something that you started, and inject and send was very important. But because first hour to fourth hour seems to be critical. But patients now, for example, from Kankon and Sange, these patients, because are sent to district hospital sometimes lacks the facilities. Absolutely, there is a problem. You need to, see, I'll tell you why. You need to rectify that 1 hour. 1 hour is critical. These procedures need to be done fully in South Goa district hospital itself. It should not be a referral hospital. It's because Jenna, CT scan zada. त्या वेळार एक neurologist needs to analyze it. What is happening? Whether this case needs to be identified as whether you have a blocked artery, and if you have a rupture or a bleed and you need to intervene during a surgery. So these are very, very critical things and happens within a short period of time. I have personally seen this because, and I'm speaking from my heart, is because one of my close relative, I have monitored that and seen that happening right in front of my eyes. I myself was in the ambulance. I myself saw how things have to move. But I was in Bangalore. I was not in Goa at that particular time. But by God's grace, things went well. And I believe because this is a very serious issue. कित्याक ज्या पद्धतीन आज भुरग्यांक जे भुरगे आहाय stroke जाता, the average if you see is increasing, especially young youth. It's because आणि एक मोठो सारको प्रश्न म्हणटा तो premature babies. Now, I believe that practically almost every day there is a premature delivery. I congratulate Goa Medical College because I always say private hospitalan जो भितर गेले सगळे C-section कदाच because हे C-section I believe Goa Medical College जे नॅचरल बॉर्न बेबी जावपाक जाय, नॉर्मल प्रेग्नन्सी जावपाक जाय, त्या पद्दतीन दे ट्राय देअर बेस्ट. बट स्पीकर सर, जेन्ना प्रीमेच्युअर बेबी जाता, स्पीकर सर, दे मेन प्रॉब्लम म्हणटाय तो थिंगा NICUचो. आनीक when you talk about NICU, the problem, there are only 8 ventilators, I believe. Anik, these 8 ventilators are basically not enough. Health Minister, they 8 ventilator padhe hai, basically they are not enough there for this premature babies. And Speaker sir, you require technically for 2 babies, one doctor, more dedicatedly a pediatric intensivist. This is what Goa Medical College, it's absolutely lacking. आज उदाहरण आम्ही आमचे डिनाचे आभार मानता दोतोर बांडेकराचे, कित्याक एक केस जाली कुंकोळच्या गांवान. हाव आय एक्सपिरियन्स दीस इज फ्रॉम माय एक्सपिरियन्स, बिकॉज ते जे भुरगें जाल्लें and that भुरगें was premature. After the baby was premature, there was no ventilators there. The baby had to be rushed to Manipal, Healthway. आणि जाल कितें स्पीकर सर, ते पेरंट्सा त्या वेळार कोणा, बट ते बील जे येता प्रत्येक दिसाक खर्च तेजो ऑलमोस्ट 25,000 रुपीज. आणि जे इन्शुरन्सा अंडर what is covered is only 5,000-6,000 rupees. So 20,000 rupees, 25,000 rupees per day they have to pay because of je ventilator na म्हणून. Because I believe that although the baby was brought back to GMC immediately after the ventilator was available, that is why I thank the Dean. But Speaker sir, this is something that we need to look with the number of premature babies born at GMC. आता टाटा कॅन्सर टर्शरी युनिट म्हणून जेन्ना अनाउन्स केलें, आमी मंत्रीक कॉंग्रॅच्युलेट केलो. आनीक जेन्ना कॉंग्रॅच्युलेट केलो, आय बिलीव there was a delay. The delay due to the environmental clearance, delay whether you have changed it from tertiary cancer center to a regional cancer center is what is in your head, and whether what is the impact, what is the number of patients expected from where, with it being a regionalistic program now. Because if you look at the number of cancer patients in Goa, it is growing. I would not say in a particular sector, but it is definitely growing, and we need proper cancer treatment. Barikshe, aaj we have good oncologists, but in the private sector also there are very few oncologists that are working, very expensive with the healthcare that is currently there. Because so maka dista, this has to change. This basically has to change. Speaking on the setup of the cat lab, je hata jenna operation korpak bhauntat, Speaker sir, we have the best doctors. आणि आमगे स्वर्गेस मंजुनाथ तिंगाना, ही वॉज ऑल्सो इन्स्ट्रुमेंटल. जावं बोरकर दोतर, जावं दुसरे सगळे जे आहे, दे आर द बेस्ट. बट इफ यू लुक स्पीकर सर, दिसा 20 केशियो कॅट लॅबान. 2 cat labs is dedicated to angioplasty and angiography. But if you look that, according to me, it's not enough, because जे intervention korpak jay, sometimes based on the severity. Anta jenna ye cat labak jata speaker jo vitor kine defect melo, block meli, जाल्यार ते टायमाक दोतोर वचोन ते stent बसयता. But sometimes the doctor takes a call, whether based on the cases, based on the emergency situation. So speaker sir, दुसरे जोरी तोर private into गेल्यार जोरी तो ते दोतरा दिसता की tabletin जावचे ना म्हणून, sometimes they take a call and they stent it. Now appointment for stents have given after 1.5 months, after 2 months, and लोक मागीर हांग फोन मारता, मातशें ते अपॉइंटमेंट आहा ते बेगीन ते भिते, अरे हाटा जालो हामू सांगलो हामू ते भिते केदो गामू सारकें हें जातलें म्हणून. So speaker sir, I believe that you have to look at this. Your peripheral vascular thing that you're doing in the old GMC, the setup is good, because there's a lot of tendency for people having diabetes. 1 in 5 today has diabetes, and with the amputations that happen, gangrene je jata, I believe that you have a good radio interventionalist je tumhi घेतलोलो ha. These type of procedures, speaker sir, need to happen day in, day out. Kidak Barik today with, as I said in the morning, interventional radiology is the future of medicine. You need to focus much more into that, and I believe that it is possible. But yep, sogle maka dista poishe जाय एका speaker sir. Event sogle माचे आमी बंद करूया. Event इले बंद केले न्हू, लोक साल्वार जातलो. Event नाचो 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 हे जालें ते जालें मग काय ना लोकां साल्वार करूया. Speaker sir, another thing is the Honorable Health Minister announced about is the robotic surgery. Now, robotic surgery is this is a welcome move. And I think Dr. Bandekar has performed some things with robotic knee procedures. But Speaker sir, the need of the hour is that we need advanced laparoscopy robotic surgery unit. आणि advanced laparoscopy surgery units because जे complicated cases आहे, ज्या cases which you do not want to open up and you want to do it laparoscopically, especially laparoscopically or advanced laparoscopy gives you a 3D depth perception. So complicated surgeries for the esophagus, for the stomach, for the colon, these are things that are done in the private hospital. But I believe in GMC it's more like the traditional. If you have an advanced robotic surgery, if someone is trained and a setup is made, I believe this will help with complicated patients of diabetes, pressure and so on. It's because super specialties of block where you do cardiothoracic surgeries or bypasses, I believe you need to set up a blood bank there. Because for one surgery you need almost 6 bottles of blood. This is something that is a need of the hour with the amount of cases moving forward. Because I sokan sanglole and now mantri koden magota. It's very important about the PET scan. 23,000, 27,000 paid outside in a private medical hospital. But the need of the hour today is that we do it in GMC, early detection, early diagnosis to get the line of treatment for cancer. And that's because the working of the health ministry has a direct connect and a bearing on the quality of the life of the people. Anik, with the amount of private hospitals being unaffordable, especially our PHCs, I believe you need to have reasonable, good facilities. Amgele 62 years of after liberation, through our CHC जाऊं जे 100 आहे, जाऊं PHC जे 24 आहे, sub centers जे 220 आहे, RMD जे 33 आहे. Somehow, because all this needs to be updated. They are all in dilapidated condition, and because our health service delivered through this PHC, UHC does not show any sort of improvement. Because timely and well-equipped ambulance service to patients. This is also something that is required in our health centers. Because hygienic washrooms, and with washrooms when I talk about bathrooms and toilet facilities, in most of these health centers, things are going from bad to worse. Urban health center जे मोडगोंच्या गावांत आहले, हे जे एक heritage health center आशिल्ले, no structural audit done, bis talpotri gan bond केल्ले. Because if you look, many buildings are constructed and which are new, they are idle, they are lying idle for long. But many buildings are also in a dilapidated condition. Because amgele je healthcare facilities, most of these CHCs, UHCs, X-ray machines are solnai, ultrasound for different types of scans solnai. You don't have proper medical equipment in most of the health centers. Mainly, je Kankonche je ek case, je ek representation amch bore ille. And them sanglale the children ward also. I think you need a full-time child specialist in Kankon. Because there is, if you look at the ambulance services to patients, this is something that the minister had done when he was with the Congress. And the 108, because at that time, currently, there is acute shortage of ambulances. And magadista patients several lives could have been saved. Speaker sir, only 60 ambulances today, as per the reply, only about 60 ambulances are in working condition. This, I believe, needs to be doubled. आमचे एक उदाहरण हेल्थ मिनिस्टर सांगपाक सोदता, आमचे बाळ्ळी हेल्थ सेंटरान थिंगान ती एम्ब्युलन्स चलना सारकी, ती नाच, बट तेज भायर एक बरी कार्डियक एम्ब्युलन्स आमकां जाय. इफ यू कॅन send that cardiac and park it in Bali Health Center, because otherwise they move all around. I think the base could be Bali Health Center. And that's because there are also a lot of cases of dengue, chikungunya and malaria. The rise is about 140%. I believe the equipment, if you look at the equipment that is said that the department has, 4 spraying pumps, 2 fogging machines, 1 thermal fogging machine, available with the health department for fogging, spraying the gutters and drains. How much can you fog with this type of equipment, Speaker sir? Speaker sir, we speak all the time about the South Goa District Hospital. And there is a good building, there is no doubt about it. What we need is equipment, what we need is doctors, what we need is surgeons, what we need is support staff. There is a talk also of privatization. Now, Speaker sir, this to start a nursing college, but I believe that I've got some answers that say that the nursing college is going to be made in the old GMC, old Hospicio hospital. But Speaker sir, medical colleges that cannot be private, because this, Speaker sir, the government had created this building and this infrastructure, and are we gifting it to a private empire? Can people in the future afford this? Speaker sir, Dakshin Goanche lok, म्हाका दिसता, will oppose this tooth and nail of the move of the government in case they want to give it to a private medical college. Speaker sir, I firmly believe, and the Chief Minister is not here, I congratulate the Health Minister. He seems to be looking young, doing procedures. I heard about biohacking and stuff. But Speaker sir, my belief is that the Finance Department has kept the Health Ministry on a starvation diet. This is what needs to be corrected, and this needs to go in the right direction. The effect is on the common man. Speaker sir, most of our finance needs to go into this health department. It's a basic necessity. Today, आमी रस्ते सार लोकांक दिनाय, उदोय सार लोकांक पावना, आनी मागीर जेवपाकूय सगळी म्हारगाय जाल्या, आनी आतां हेल्था जरी तर ही बारीकशी सुविधा आमी दिवपाक शकनाय, लोकांक आनी आमी हिंगा आमदार म्हणून ओ मंत्री म्हणून कित्याक आहाय? Speaker sir, most of these things have been stalled, I believe, is because of inadequate finance. Speaker sir, Dakshin Goanche जरी तर आमी डेटा चोयल्यार, it's shocking to see that 17,452 referrals are made in the last 4 years. 17,000. Almost, on an average, 1200, 1300 people come there in the OPD. Now, there is one nephrologist who comes from Apollo Victor, one cardiologist, Speaker sir, who comes once a week from GMC. Speaker sir, जायते blood test करपाक जाय when people come with something, but there are few things. Normally they do something known as a complete blood check count or a CBC, but normally they stay away from doing LFTs, from RFTs, especially in the night. Speaker sir, cardiac enzyme markers म्हण आसता, whether a person is supposed to get a heart attack, but this result comes after 12 hours. Speaker sir, it's not in district hospital, it's not done immediately. You have to look at this. 2D echo, that a normal scan of the heart, this as well, Speaker sir, is done once a week, I believe. Speaker sir, stroke jenna thrombolize korta, you need a senior person there, because when you thrombolize, there are chances of even bleeding cases happening. That is lacking. Ek doctor looks after 120 patients. This is the load. Imagine you have 120 patients for an instance and one doctor. You have, Speaker sir, 30 medical officers working there. Absolutely, the radiology department works with one CT scan machine. There is no MRI machine. That's a basic thing that the doctors, you give them some equipment. CAT lab unto jenna mantri announce kele, I congratulated him. आणि आमकां दिसलें आतां CAT lab it's a need of the hour in the South Goa. But आज जरी तर if we look at the answers, it is shocking. It says that the CAT lab will be on the roof of the South Goa District Hospital, on the terrace. And on the terrace, there is no roof, is the observation of GSIDC. Speaker sir, where are we heading? This is something I believe that is needed and is the need of the hour. जे पद्धतीन आज road accident जे जाता है, neurology is something that is very, very sophisticated. The neurologist itself over there are not present in South Goa District Hospital. Speaker sir, जे थिंगा GSIDC जे repair work म्हणून जे contract आहलो, that contract is over. The blood component separation unit that was required in South Goa District Hospital. Normally, during dengue cases, you get something known as a single donor platelet thing that separates the blood plasma and whatever. But I believe a blood component separation unit is required at the South Goa District Hospital. The casualty muntai is completely flooded. Poor doctors, they can't do. Ami hoite sometimes to check. They cannot help with the amount of cases, the accidents arising. Speaker sir, another observation, and I would like to tell the Honorable Minister, is Dr. Edward Dimelopodek, senior physician. He is retiring soon now. He is retiring very soon. And there has to be a replacement done immediately. ICU he has started, that is a good thing. One observation is that there is a lot of sunlight in front of the pediatric and the ENT OPD there in South Goa District Hospital. I don't know what is this, why is this sunlight, but you need to cover this place. Speaker sir, MRI machine mutte tinga na. The doctors are complaining. Speaker sir, the doctors are complaining.
Honorable member, how much longer would you take? I think you've had enough
10
of
minutes.
time.
Sorry?
Yeah.
I didn't speak. 30 minutes I spoke. I started another 10 minutes.
5 minutes. 5 minutes.
10 minutes. Je, Tinga, all retired staff, whatever they have to be taken. Now, one of your answers that you have given, if you look at the total number of vacancies, I'll be a little fast. 173 and 193 with regards to contract, bond, NHM basis. This has increased from last time, that was 143 and 157. So you require, and the increase is 27% in the last 1 year. Speaker sir, you say that the government, there is a ban on creation of posts in all the departments. But what stops you from filling the vacancies? Minister Bab, what stops you from filling the vacancies of the sanctioned list? What stops you from filling these positions? Speaker sir, answer amka, whatever we've got to know, setting up of CAT lab is on, I would summarize this, setting up of CAT lab is on terrace, there is no roof. Your reply says that GSIDC wants to build the roof. Modalities, plans to set up neurosurgery is still being worked upon. Private medical college is under process. Administrative approval for setting up nursing college in old premises hospital. No proposal received regarding All India Institute of Medical Science or branch of AIMS at South Goa District Hospital. No proposal regarding private nursing college. Speaker sir, categorically I would like to ask the Honorable Minister that on what government intends to do with respect to the CAT lab, with respect to the neurosurgery unit, with respect to the private medical college, with respect to the nursing college, with respect to All India Institute of Medical Science, what is the timeline by which this CAT lab and the neurosurgery will be commissioned? Speaker sir, Goa Dental College this dental college was formed with, they had a motto was for great dental care facilities, dant bore this spark. But answer because the treatment is delayed, and we need a full-fledged dental clinic also in the south under the supervision of Goa Dental College. Now, Speaker sir, sometimes the patients have complained, Honorable Minister, that even normal gloves and normal saline is missing. Speaker sir, senior staff do not come on time. This is what is, there's a written thing given to me. Speaker sir, जे resident doctor hai, most of them do the work. You need to check, cross-check using your biometric system. This is something that is very, very essential. Speaker sir, जे waiting list ha, especially in the department of conservative dentistry and endodontics. These two departments, there's a huge waiting time. Speaker sir, जे far away patient जे रहता है, because of the Goa Dental College winding up early, I believe the time is 4 o'clock. I request the Honorable Health Minister to look into it. It is very, very serious because patients come from far away. Now, IPHB che aun ulela, but I feel that 90% of our focus should be of the ministry falls on the physical health and the physical disease. But the growing stress in the community have thrown up challenges to all of us. And this mental sickness and abnormal behavior and the amount of suicides that are happening is on the rise. IPHB has to be modernized. The government should have extension centers of counseling and treatment also in district hospitals. Speaker sir, je budget and Mukhya Mantri
Under Rule 16, I would like to move the motion to extend the duration of sitting House by 30 minutes, half an hour, 30 minutes.
Speaker sir,
The motion is that the duration of the sitting of the House is extended by half an hour. Those in favor of the motion may say aye, and those against may say no. The ayes have it, motion is adopted.
Speaker sir, the Chief Minister has announced in his budget about the 100-bedded IPHB hospital and given a deadline of 12/24, December 24. This is something that needs to be done as early as possible. So basically, summing up the entire health ministry, I feel that the finance ministry has put the health ministry on a starvation diet, since the Honorable Chief Minister is also there, and this needs to be looked into very, very seriously. I believe we require to increase the budget, increase the equipment. Other speakers are speaking on the last of Foods and Drugs Administration. Currently, with the fishing ban, our demands are met from our neighboring states for fish. Anik, there seems to be no setting up or testing of that lab. Je amka promise kelle, I think last now 4 years it has been promised. Suresh Prabhu promised kelle, a lot of people work towards it. Currently on the ground, nothing seems to be there. The focus, because we read about raids in the FTD department on establishments and pharmacies. But there are a lot of people that also, there is a vast unchecked areas. For instance, food vendors, street vendors, food stalls, fruit and vegetable vendors, food products, manufacturing units, these go out of the scanners. Because your government has also failed to conduct routine quality testing on potable water supply. This is also something with water tanker water that is supplied. This is something that you need to look into. Adulteration, adulteration in food products. This needs to be looked into. The focus because of FDA, this basically is on irregular raids, big news and poor surveillance. Because surveillance should be on food items also coming by trains through the borders. Last, I would like to tell the Honorable Minister that there is a provision of GMC that when they purchase medicine, certain percentage of drugs need to be tested by FDA. I believe the audit has raised a query that testing of batches of medicine is not done, which may be injurious to the health of the citizen. Just as an instance, before I close, because I had an answer and a reply that under the Food Safety and Standard Act 2006, the amount of Dapusa in the last 5 years, 10 times only the canteen inspection zala. There is no control of FDA over e-pharma apps or online pharma delivering in the state. Speaker sir, with this, I would like to end and request the Honorable Minister that he replies. Thank you, Speaker sir.